Tuberculosis, TB, is a global disease found in every country in the world. Despite significant progress, the treatment regimen for TB remains burdensome, requiring drugs to be taken regularly for several months. The long duration of the treatment has caused adherence problems and the emergence of drug-resistant bacterial strains. The Minister of Health launched the National Tuberculosis Manual. The manual represents a scientific reference to the health workers in this field. Again, is part of implementing the national strategy for elimination of tuberculosis and is aligned with its pillars, namely detect, treat, prevent and promote.
This manual is a collective work of specialists in the field, and it is one of the projects of the National Strategic Plan for Ending Tuberculosis. On the same day, we have also conducted a training workshop for the governorates with regards to the implementation of community observed treatment for tuberculosis in the community.
The launching event included a training workshop that targeted all focal points in the governorates to train them on the community DOT, directly observed therapy protocols and methods for implementation. Specialist at the DGDSC stated that today's event is a culmination of years of continuous joint work with the healthcare workers concerned with the TB in public and private sectors to provide a better healthcare for community various segments.
Launching of this National Tuberculosis Manual is help us as a doctor for early diagnosis, management and follow-up of the tuberculosis cases. At the same time, today we have launched the new policy on community dots. It means some of the particular TB cases we are going to manage in the home or their residence. So it will help us to reduce the burden on the hospital.
The specialist affirmed that TB is preventable and curable. All members in the community must be aware of this fact to end stigmatization and discrimination of TB, adding that awareness should be also raised on the importance of diagnosing and treating TB in the high-risk groups, such as close contacts with TB cases, particularly children, people coming from high-incidence countries, as well as immunocompromised patients. Launching of this National Tuberculosis Manual here will assist in managing TB cases here in the Sultanate of Oman. TB is preventable, treatable, and curable if medicine are taken properly. Abdallah bin Ahmed Rubaiey, Sultanate of Oman Television, Muscat.